Hello. In the recent weeks, many people around the world and in the UK have been vocal against the COVID-19 lockdown measures. One of the arguments that are sometimes brought against the need for lockdown measures is that COVID-19 would not be as deadly as it is depicted. And one of the points people often use to support this narrative is that many deaths would be wrongly attributed to COVID-19, while they would be actually caused by underlying conditions or even by completely different causes. Now, I don't believe that's the case, but I wanted to make conclusions based on facts and data rather than opinions. So I looked for official data and did some basic aggregation and visualization. And I wanted to share this short analysis with you. First of all, I want to make clear that I'm not a professional in statistics or data analysis, but what I did is some very basic aggregation based on official data. So I don't believe I've made any significant error. But that said, if anyone with background in statistics finds any inaccuracy, please do let me know. The data set I used to analyze the situation in England and Wales are from the Office of National Statistics, and they are updated to the 8th of May 2020. Okay, so this controversy on the reliability of data on COVID-19 related deaths comes from the fact that attributing the cause of death is not as straightforward as it might seem, because it depends on guidance that might be issued at national level or local level. And so it could potentially vary between countries, local areas, or even between different hospitals. Plus, there might be some degree of subjectivity. So, for example, if a person with a pre-existing heart condition is admitted to the hospital with COVID-19 symptoms and then dies because of heart-related complication, do you attribute the cause of death to COVID-19 or heart disease? And what if the person is admitted not for COVID-19 symptoms, but for heart attack, and then it tests positive to COVID-19? So this is to make the point that data on attributed deaths can be controversial, or at the very least, they are likely to be perceived as controversial. So why don't we put that aside for a moment and we look at some other data that are much less controversial. In this chart, we can see in the orange line the number of weekly deaths in 2020. This is regardless of the cause of death. Now, let's compare it to the average number of deaths in the last 5 years, so 2015 to 2019, which is the blue line. And here we see something interesting because the orange and blue lines are very close to each other until week 13. And after that, there is a very, very steep increase. There is a specific term for this, and that is excess deaths, which means the additional deaths that we are seeing compared to the regular number of deaths that we could expect in this period of the year. We can also see the minimum and maximum weekly deaths over the past 5 years. And even if we compare the 2020 weekly deaths to the maximum values over 5 years instead of the average, we can still see that the 2020 values is constantly below the maximum value, which is the green dotted line, but only until week 13. After that, it goes up. And we can see the same thing from a percentage point of view. So the percentage variance in weekly deaths in 2020 compared to the average on the same week in 5 years average. You can see that the variation is quite small and mostly negative until week 13, and then there are large increases. In some week, we have even more than 100% increase in deaths compared to the 5 years average. Plus 100% is huge. So is it a coincidence that we have a pandemic situation going on and at the same time we have such a steep increase in deaths compared to the past 5 years? Now, some people might say, yeah, but there could be other causes. And yeah, this chart alone doesn't prove a causation, but at the very least, it shows very, very strong correlation. Just to put things into perspective, the chart on the bottom shows the percentage variance in Italy. In Italy, we have a monthly split instead of a weekly one, and the data are updated to the 15th of April. But it's interesting to see that the excess deaths in Italy in March and April, which were the peak period there, were between plus 34 and plus 38%. Now, we also need to say that in Italy, the impact of COVID-19 was more concentrated in some areas. So the average might not be a great indicator here, while in the UK, it was a bit more widespread. But we'll see more data about Italy a bit later. For now, let's focus on England and Wales. Let's go a bit further and see if there are other correlations. So the blue columns here are the average death over the past 5 years. So what we would expect in a normal situation without pandemics. Now, let's add on top of this the disputed data that we put aside before, which is the deaths officially attributed to COVID-19, here represented by the yellow columns. Summing them up, we could reasonably expect to obtain values similar to the total deaths registered in 2020. Is that the case? Let's see. Let's add the orange line that indicates the total deaths in 2020, regardless of the cause. First thing we see is that there is a strong correlation between the deaths in 2020 and the sum of the average death over 5 years plus those attributed to COVID-19 in 2020. So what this suggests is that the deaths for COVID-19 are not overestimated. Actually, quite the opposite. We see a gap between the two values. That means we are seeing more total deaths than we could explain just with the official data on COVID-19 related deaths. So, what is causing this gap? We can make a few hypotheses. One thing we could take in consideration is that this might just be a normal variation from the average and nothing to do with COVID-19. But this is really not convincing enough because why would this quite big gap exist only from week 13, while it was visually inexistent in the previous weeks? So let's exclude this because it's really not backed by data. Another very possible option is that the COVID-19 deaths are actually underestimated. And if that's the case, it would be quite worrying because the decisions to ease lockdown measures can be partially based on this value, among others, of course. And so it could possibly lead to a premature easing. Now, another possible cause is that the healthcare system might be overloaded because of COVID-19 cases. And so people with other conditions might not receive treatment in time, and that could increase the death toll for other conditions as well. And also, people with other conditions might feel discouraged to seek medical attention because of fear to catch COVID in hospitals. But that could lead itself to missing crucial medical care, which could also increase the death toll. So, which one of these is it? I don't know. It could probably be a mix of all of this. But the point that I do want to make again, and I want to stress, is that there is a strong correlation, and that data indicates that COVID-19 deaths are not overestimated. Now, it would be interesting to see if we find the same pattern in other countries as well. I live in the UK, but I'm from Italy, so I looked at the Italian situation as well, so I'll briefly share that. The data that I used to analyze the Italian situation are published by Istat, which is the national statistics body in Italy. And I also used some data from the ISS, which is the Italy's main healthcare authority. This data cover 57% of the total population and 71% of the population resident in the areas most impacted by the pandemics. So not the total population, but enough to show us a good representation of the situation. And as I said before, the impact of COVID-19 in Italy is quite diverse depending on the geographical areas. With the north being impacted way more than the rest of the countries. So we're going to see first the data on national average and then the data specific for the most impacted areas. So let's start from the national data. Again, we have a monthly split rather than a weekly one, and the data are updated to the 15th of April. But we do see the same pattern in terms of excess deaths. The orange and blue lines are pretty close on January and February, and then there is a strong increase in March and April. Same thing in terms of percentage variance. Here we see actually a slight decrease in 2020 deaths compared to the 5 years average in January and February, and then a clear increase in March and April. If we do the same thing we did for England and Wales and we compare the total deaths in 2020 with the sum of the 5 years average plus the deaths officially attributed to COVID-19, here is what we get. The February data are quite interesting because it actually indicates a possible overestimation of COVID-19 deaths. But the March and April data instead show again strong correlation between the excess deaths and the COVID-19 deaths. Now, if we look at the most impacted geographical areas, the number of excess deaths is much higher, as we might expect. And the percentage variance is even more dramatic, even though it still looks lower than what we see for England and Wales. Okay, I hope you found this useful. My objective was helping people build their ideas based on data rather than just on opinions, which is something that I think happens less and less nowadays. If you're interested, I recommend looking for reliable data yourselves. And here you can see the links to get to the data sets that I used for this analysis, but they are included in the video description in YouTube as well.